So, on this day, the International Day of the Older Persons, I am happy to introduce our first speaker, Amrish Badjoe. So, Amrish, please make your way up. Dr. Amrish Badjoe is currently the director of MSF Luxor, the Operational Research and Epidemiology Support Unit of MSF, Operational Center Brussels. He's an infectious disease epidemiologist and microbiologist and has worked in different humanitarian contexts with different organizations, such as the International Committee of the Red Cross and the World Health Organization. He still has a foot in academia, where he frequently teaches courses in global health and epidemiology and collaborates with academic partners. And today, Dr. Amrish Badjoe will be giving a welcome word on behalf of MSF. Welcome, Amrish.
Thank you. So good morning, everybody. Indeed, I'm Amrish, and I'm here. Very happy to be here today, and I could also see like the personal journey that Elberg and many of the colleagues followed to actually have this subject on the agenda. And I kind of wanted to open the session as an icebreaker, which is always kind of mandatory, but also kind of starting like, how we got to the point and why someone who's not really involved in the subject also believes this is a very important subject for humanitarian organizations, and especially those with a medical footprint. So a bit of a background for those that are not familiar with MSF yet. MSF is kind of built on two main pillars: delivering medical aid where it's needed. We do that independent, neutral, and impartial. Obviously, these are concepts that today are tested in real life. What does it mean to be independent? What does it mean to be neutral? What does it mean to be impartial? But I believe that's a whole symposium by itself. The second pillar, which is equally important and is one of the reasons that I'm very happy to work with MSF, it's not just about delivering the medical act, it's also very much about speaking what we see in different contexts and do so by medical witnessing, listening to our patients, echoing their voices, but also try to really push that towards channels that can further disseminate the message of what's happening in different contexts, like, for example, Gaza or Sudan, or many of the other emergencies that we're working in. And also that is, of course, a whole discussion we can have, but it kind of boils down to that advocacy agenda. How do you push change in public health? It's obviously not just science. It's not just writing scientific papers. It's really taking these findings and bringing them into the public arena, identifying this vast diversity of stakeholders that we need to convince that actions need to be taken, that funding streams need to be diversified, or that things are being done for which accountability is needed. And that's, of course, a very current thematic in a current very tense global world, where I believe that many of us as global health professionals really need to reflect on what our role is in that. MSF was founded in 1971 as a relatively small organization that kind of split off from another famous organization with the Red Cross, specifically to that, challenging that concept of neutrality and speaking out where we saw things happening. From a small group of 13 founding doctors and journalists, 300 volunteers, today it has grown out to be a organization of around 70,000 people, 169 nationalities. We have operations in over 70 countries. And for all the funding we receive, it's all public funding. So the general public, we don't receive government funding, which has a lot of strengths, obviously, especially in a heavily politicalized environment nowadays. We're also proud to say that all our finances are quite transparent, and that 82% of our financial resources are allocated to direct delivery of humanitarian medical programs. Well, this kind of a map of impartially, and especially in Europe, kind of reflects the amount of offices that we have, but also where we have operations and the diversity of it, which is ever growing nowadays, and might be growing in the future as well, with all the critical gaps that we are already observing today, but that will be escalating in the future as well. When it comes to the different subjects we cover, it's a wide diversity. And obviously, it's heavily context dependent, but we also see that contexts in themselves are very dynamic. If you look at the current budget cuts, at the moment, I think of the global malaria case burden, for example, we treat as MSF 5% of the global burden of malaria cases. And we know that with the funding gaps, that a lot of national malaria control programs will not be able to sustain basic preventive intervention campaigns. like the distribution of bed nets. So it's probably very likely that we could spend our whole operational budget just on treating malaria in the future. So yeah, how the image is going to look of like, what do you cover? For example, non-communicable diseases is very much a field that is kind of upcoming, but at the same time, it's one of the most expensive fields to invest in. So also us as an organization need to critically reflect what pillars are we going to invest in or keep on investing in, and what will other partners do. And it's a very messy discussion at the moment. That's something we can all see. Well, I don't think I need to explain what the changing trends in humanitarian response are. There's a nice report by OCHA that you can see every year, the Global Humanitarian Overview. And I haven't seen a report in my professional career that ever stipulated positive trends. We see more fragile and conflict-affected areas. They're growing faster, obviously amplified to climate change and also amplified by the positive effects of the pandemic. We still left a lot of dents also in our own societies that we never really recovered from. We see more people being displaced by conflict, forced displacement is increasing, duration of responses is in general longer, and financial support and attention is not growing accordingly. In general, responses have also become more complex because of the fast political layer over them that also gives us a lot of issues with access, for example. So our capacity to respond to emergencies, to assist those that are affected, is radically tested. Now, coming back to the aim and the purpose of the symposium, I think one of the questions that I've always seen is like, we like to categorize, we like to categorize in diseases in target groups, but sometimes we forget that communities and societies are a living being. And I think this is a nice picture that illustrates it. I mean, we see here multiple generations in a picture. It was obviously artified, but it also comes down to who tells the stories of what once was before, how our journey went. And I think for us, that should also reflect very personally. There's an interesting discussions we always had about, if we talk about older people in humanitarian crisis, the fact that we have so little focus onto this, where does it come from? And it's something that also was clearly reflected during the pandemic. Some of the earliest discussions in, for example, Cox's Bazar in Bangladesh was, how can we shield populations? So we just take them out, put them in a separate part of the camp, and they don't get infected. And it hardly ever took into account the social cohesion effect that it had over people that were already very much escaping a genocide that was occurring in Myanmar. We didn't explain anything, and it was just a bland academic proposal, just with the idea cutting disease transmission, and then we protect this community, the elderly and the vulnerable. The other part to that is that people didn't understand that, parents are the working class, they need to work, but who's going to take care of the kids? Those are often the grandparents in these type of communities. And once upon a time, it was also very much what's happening in our own communities here, but we kind of outsourced it to saying, well, if you are not economically viable anymore, and I think people from the Netherlands remember the discussion on doorhoud, then you don't really count. And it becomes a dichotomous discussion between, are we choosing for the young people or are we choosing for elderly? And what we want to show today, that it doesn't have to be like that. So part of the discussion is also kind of like, when we talk about intersectionality, we know that these discussions quite often can become quite complex. But in principle, when we talk about intersectionality, we can talk about very complex subjects. But fact is that in a lot of the responses, we have not covered the basics. And I think that's something that we need to keep in account, that when we look at the medical coordinators in our projects, they get loads of questions. Put on your climate lens, put on your lens of intersectionality. And they get lost in all of it, because in the meantime, they also have to deal with all these complex decisions on the ground. So we need to disentangle the complexity and be very concrete in the recommendations we want to give. So as the mandatory icebreaker, we would like to know, who are you in the room? But we're not gonna go by everybody. We have a nice Menti. I hope you guys can scan the QR code. Uh-oh. Yeah, okay. You can't scan it or it doesn't log in. Give me a sec. Give me a sec. Yeah, exactly. I'll do it this way. Percent. Okay, let me see why my screen is not going to presentation mode now. So trying to scan this.
Sorry, we're all coming.
Yeah, that's kind of the idea. We want to have some mobility amongst participants. Yeah, I see we have about 22 people, and the QR code will also be in the next slide. But now you can see on your phone the next question, and that's like, where's your office? Yeah, and obviously the map is relatively small. So this is also an exercise of your your fine motoric skills. No. I knew that comment would come up. Yeah. By proxy then. Okay, I see someone is near the vicinity of the North Pole. Okay, nice. Oh, okay. So there's some graphical design errors as well.
Not the North Pole, that's the new part of the USA.
Yeah, okay.
I just quoted.
No, I see there's some technical complexities for some reason on the phone. Not sure why. Oh, there they are. Look at that. We're managing pretty well, actually. Yeah.
Thing that I have to try and get mine on. You're the big people.
It still seems like a plausible outcome for a map. Okay, like going to the next question is like, where are your roots? No, we're fully dichotomized. You can only have one root. So. QR code is gone, so if you're not, but it should bring you to the next question automatically.
No,
Well, I'm wondering if we have Santa in the room. Like
About people from Greenland.
yeah, never mind.
I find the subject tremendously important. What sector do you represent?
Academia.
Yeah, I think this was an easier one to just click on. So, this is an open question. What brought you here today? Yeah, not your mode of transport, obviously. So a lot of interest in the topic, curiosity and scientific interest. Someone who's a speaker, it's also quite intuitive then to be here indeed. But also interest in the topic. Yeah. Knowledge, connecting perspectives from different organizations. Invitation from a filmmaker. Yeah, I mean, there's the office train. The need for MSF to do better.
That came from inside.
It's always coming from inside. Yeah. I think we always value the lively debate inside the organization. So. Okay, do fill it in. Like Mindy has this nice feature nowadays where theoretically I press a space bar and it tries to categorize the results. And it's a bit of a hit or a miss. So we're just going to try it, see how it looks. So curiosity, knowledge sharing, yeah, the humanitarian part, elderly, obviously. Yeah, that's I think that's the common denominator. Interest, bit of networking, people being speakers. Yeah. So what do you see as the biggest bottlenecks around the inclusion of older people in humanitarian response? I'm not sure how well it's readable from the back, but there's a lot of lack of political will, lack of attention, lack of awareness, indifference, older people not having a voice, scarcity of resources, they're overlooked, lack of will amongst responders and NGOs, lack of capacity in MSF, lack of training in MSF. Okay, great. Keep on feeding into because we think this is also quite useful for us. It's one of the exercises where we gather a little bit of thoughts from you all. What should be the most significant actions humanitarian actors should take to become better in inclusiveness in their response? And I promise, I think this is the last one. Because otherwise, I'll take you to the next tea break. I like the answer, care about everybody's needs and consider it an integration instead of an additional question or an additional thing stacking on top. Capacity building, collect data and insights as well as making it visible, build momentum, tailoring activities to include older people. MSF can do better. I was just looking at that corner somewhere. Okay, great. So just gonna see how I can quit this and then go back to the last slide of the PowerPoint. So our common role today. We know why you're here. We kind of get an idea by the Menti. You're here of common interest. And we all agree, I think there's a necessity to build bridges between the different types of stakeholders and partners we have in the room. Our different disciplines are always an added addition. So I would highly recommend everybody, as always, to be curious, but also to be bold. Ask critical questions, because when we ask each other critical questions, that's how we really learn and how we improve. There's a lunch, there are tea breaks, use that to network, to speak with each other, be collaborative. We really have a chance here, I think, to jointly shape and contribute to the agendas for the common good. And I think as the biggest denominator when we bring people together is not that we have a talking meeting with just an array of speakers, but it's really to see what can we do with all these thoughts, all this science, and all this operational willingness as well. So with that, have a great session today. Up for the next speaker.